You've both got a crystal ball and a magic wand. What one thing would you wish to see happen in the management stroke diagnosis of prostate cancer over the next 5 years? You have a crystal ball and a magic wand. What would you wish to see happen in the management and diagnosis of prostate cancer in the next 5 years? Peter, could we start with you, please?
I mean, for me, we touched on some of this earlier, but if in a national screening program, which when the patient is then referred, that patients get their tests done quickly, and they get their results given to them on the same day. There's an MDT on the same day where the patient can attend and discuss with those people there what the treatment should be, and then they would come back and either decide there or have a chat with their GP, who they can get an appointment with within a few days, and who they know well because the continuity is much better, and you know, so everything. So the communication is really good for patients. So patients not getting results quickly, I think, is a real stress for patients. You know, everyone every blood test you wait for, and every test you do is hugely stressful. So you know, I know it's impossible at the moment, but to bring those times to speed that up would be great, and for information to come to patients quicker would be my big wish.
I was thinking about this. I think it's unlikely there's going to be a national screening programme for all men. I don't think there's resources for that. But, you know, the PSA test, we've had it like 22 years. I've had this test that's not brilliant, really. You know, it's, you know, hopefully men would have something better, really. You know, so a better sort of screening programme, really, targeting maybe... you know, we have to start somewhere. So maybe we need to start with the at-risk groups. Maybe we need to start with, you know, black men. Maybe we need to start with men with a family history. Maybe we need to start with maybe the younger demographic. We need to make some sort of start in some sort of area and start to make some progress in that way is what I'd like to see.
Okay, so controversially, I'm going to disagree with Peter, but not fundamentally. So I have a big problem with targets. I'm all for patients being told the diagnosis as quickly as possible by the right people and the right treatment being delivered, etc., etc. But I think the targets are creating problems because it's putting pressure on clinicians, it's putting pressure on admin and clerical and nursing staff, which isn't necessarily required. So if we look at prostate cancer, many prostate cancers are not going to be an immediate threat to the man in which it is diagnosed. Many low and intermediate risk prostate cancers will not kill that man, even if it was left alone for a decade. So why have we created a situation where we're pressurizing health professionals and patients to make decisions about treatment within 31 and 62 days, when actually the disease is never going to be a danger to them in that time frame? So I personally would like a bit of a review of the target culture in the NHS, because what's the point in having targets when places and the country is constantly failing? How does that make people feel when they're working in that environment to be told, you're failing this, you're failing that? Do you think it makes them feel good when they go to work? So there has to be a huge change, I think, in how we're trying to measure investigations and treatment and what we're trying to do with our treatments. So pressurizing a man to decide whether or not to have a robotic operation or radiotherapy to meet a target is totally wrong. So that's one thing I would like to be reviewed with my magic wand, but I'm going to snap it in two, because the other thing I think that needs to be seriously looked at is results and outcomes. So I think every unit in this country should display and publicize its outcomes for prostate cancer treatment, because I think there's some things happening in England, Scotland and Wales which are a bit uncomfortable. I've already highlighted that people in Worcestershire are offered radical treatment in their late 70s and early 80s. I know that patients with exactly the same disease in other parts of this country will be told no. Also, I think we need to look at the effect of robotic surgery on outcomes? Is it delivering good outcomes functionally, oncologically? Nobody, I don't think, really knows this. This robotic technology has been around for a while and has been fully embraced, but are we being honest with patients about, well, how good is it? And the only way to do that is to wave the magic wand, and every unit has its results open, transparent, so that patients and the GPs that are looking after them know that they're getting good care.